In a quiet but significant shift within the field of women's health, a hormone long associated almost exclusively with men is now emerging as a powerful ally for aging women. Testosterone, once considered solely a male sex hormone or a substance reserved only for boosting libido in women, is gaining recognition for its broader and more essential role in female physiology, particularly during perimenopause and menopause. A recent in-depth lecture delivered by an experienced physician has brought this under-discussed topic into sharper focus, illuminating how testosterone impacts not just sexual function, but also cognitive clarity, emotional stability, bone strength, muscle preservation, and overall vitality. This evolving understanding challenges decades of medical dogma that either ignored or dismissed testosterone's importance in women's hormonal balance. The implications are far-reaching, especially for the millions of women navigating the complex terrain of hormonal decline. As estrogen levels plummet during menopause, many symptoms, such as fatigue, mood swings, brain fog, and loss of motivation, are often attributed solely to estrogen deficiency. But what if another key player was missing from the equation? Testosterone, it turns out, plays a foundational role in maintaining a woman's sense of well-being. It is produced primarily by the ovaries and adrenal glands, with production declining steadily through perimenopause and sharply dropping after menopause. By 1 year post-menopause, testosterone levels may have fallen by as much as 50 to 80%. This drop occurs more gradually than estrogen loss, making its effects harder to detect at first, but no less impactful over time. While testosterone is most commonly linked to sexual desire, its influence extends far beyond the bedroom. Receptors for testosterone are found throughout the body, in the brain, bones, skin, heart, muscles, and even breast tissue. This widespread presence underscores the hormone's diverse physiological roles. In the brain, testosterone supports cognitive function, memory, and emotional regulation. Declining levels can lead to irritability, anxiety, depression, and difficulty concentrating, symptoms that many women report but often dismiss as simply part of getting older. In the skeletal system, testosterone contributes to bone density by stimulating osteoblasts, cells responsible for building new bone, and inhibiting osteoclasts, cells that break down old bone. This action works synergistically with estrogen to maintain strong, resilient bones, a critical factor in preventing osteoporosis and fractures later in life. Without adequate testosterone, even optimal estrogen therapy may fall short in fully preserving bone health. Muscle mass and strength also benefit from testosterone. As women age, they naturally lose muscle, which can lead to weakness, reduced mobility, and increased risk of injury. Testosterone helps preserve lean muscle mass, support metabolism, and enhance physical performance, all of which contribute to a more active and independent lifestyle in later years. Skin and hair health are similarly influenced by testosterone. Many women notice thinning hair, dry skin, and loss of elasticity as they age. These changes are not merely cosmetic. They reflect underlying hormonal shifts. Testosterone helps maintain skin thickness and collagen production, contributing to a more youthful appearance and improved wound healing. Even urinary and genital tissues depend on testosterone for their integrity. Genital atrophy, vaginal dryness, and urinary incontinence are common complaints among postmenopausal women, and while estrogen replacement helps, adding testosterone may offer additional benefits by restoring tissue resilience and sensitivity. Understanding the interplay between hormones is essential to grasping why testosterone matters so much in women's health. Hormones do not operate in isolation. They are part of a dynamic biochemical network that includes cholesterol, progesterone, estrogen, and various androgens like testosterone and DHEA. Cholesterol serves as the precursor to all steroid hormones, meaning that disruptions in lipid metabolism can affect hormone production. One fascinating aspect of this hormonal web is the ability of testosterone to convert into estradiol, the most potent form of estrogen, through an enzyme called aromatase. This conversion means that testosterone supplementation can indirectly support estrogen activity in certain tissues, such as the bones and breasts. Conversely, estrogen does not convert back into testosterone, highlighting the unique and irreplaceable role that testosterone plays in the female body. This intricate relationship explains why some women may not feel fully restored on estrogen therapy alone. By restoring both estrogen and testosterone to premenopausal levels, clinicians can create a more balanced hormonal environment that better supports overall wellness. Despite its clear physiological importance, testosterone therapy for women remains controversial and largely unregulated. One major reason is that no testosterone formulation is currently FDA approved specifically for use in women. Most available products are designed for men, leading to confusion around appropriate dosing and administration. Additionally, there has been a persistent fear among both patients and providers about potential side effects, such as facial hair growth, voice deepening, or acne, effects typically associated with high-dose testosterone in males. However, these concerns are largely unfounded when testosterone is used judiciously in women. Clinical experience shows that virilization effects occur only with overdosing, which can be avoided through careful titration and monitoring. Another barrier has been the lack of formal guidelines and research specific to women. Much of the existing literature focuses on male hypogonadism, leaving a gap in evidence-based protocols for female hormone therapy. As a result, many practitioners rely on anecdotal experience or outdated assumptions rather than current clinical insights. There is also a cultural stigma surrounding testosterone in women, rooted in gendered perceptions of hormones. Testosterone has historically been portrayed as a masculine hormone, reinforcing the idea that women should not need it. This bias has led to missed opportunities for symptom relief and quality of life improvement for countless women. One of the most important revelations from the lecture is the critical role that metabolic health plays in hormone therapy outcomes. Before initiating testosterone replacement, it is essential to address underlying insulin resistance, poor fat metabolism, and chronic inflammation. These conditions can impair the body's ability to utilize hormones effectively, reducing the benefits of therapy and increasing the risk of adverse effects. Insulin resistance, in particular, is a major disruptor of hormonal balance. High insulin levels promote fat storage and trap hormones in adipose tissue, where they become inactive. This reduces the availability of free testosterone, negating the intended therapeutic effect. Moreover, elevated insulin can exacerbate androgenic symptoms, creating a paradoxical situation where low testosterone leads to signs of excess androgens due to disrupted metabolism. To optimize hormone therapy, clinicians must prioritize metabolic interventions such as dietary changes, intermittent fasting, and exercise. Low-carbohydrate and ketogenic diets have shown promise in improving insulin sensitivity and supporting hormonal equilibrium. Additionally, managing stress and cortisol levels is crucial, as chronic stress can further dysregulate the hypothalamic pituitary adrenal (HPA) axis, affecting hormone production and utilization. These findings underscore the importance of a holistic approach to hormone therapy, one that considers not just the hormone itself, but the entire biological ecosystem in which it functions. When it comes to administering testosterone to women, the method and dosage are critically important. Unlike in men, where injections and gels provide standardized dosing, women require much smaller amounts, often less than 1/30th of a typical male dose. This necessitates precise compounding and careful application to avoid systemic exposure. Topical delivery methods, such as creams or gels applied to the thighs, arms, or abdomen, are generally preferred because they allow for steady absorption and minimize fluctuations in blood levels. Some formulations combine testosterone with estrogen, leveraging the synergistic effects of both hormones. Compounded testosterone products are widely used due to the lack of FDA-approved options for women, but they come with limitations. Variability in potency and absorption can make them less predictable compared to commercially manufactured products. For this reason, some experts advocate for using FDA-approved testosterone formulations off-label in carefully controlled doses. Dosing must be individualized based on symptoms, lab results, and patient history. Starting with very low doses and gradually increasing allows the body to adjust without triggering unwanted side effects. Blood tests measuring free and total testosterone, SHBG, sex hormone binding globulin, and estradiol levels are essential tools for monitoring progress and ensuring safety. Identifying testosterone deficiency in women requires a nuanced clinical eye. Many of the symptoms, such as fatigue, weight gain, mood changes, and cognitive difficulties, are often chalked up to normal aging or attributed solely to estrogen loss. However, closer examination reveals patterns that point to androgen insufficiency. Physical signs include thinning hair or mild male pattern balding, pale, fragile skin, loss of muscle tone, increased abdominal fat, dry eyes and brittle nails, and reduced pubic and underarm hair. Behavioral and emotional indicators may include diminished motivation or assertiveness, lack of interest in previously enjoyed activities, anxiety or depression, and difficulty concentrating or remembering things. These symptoms often go unnoticed or untreated, leaving women to struggle unnecessarily. Integrating testosterone assessment into routine menopause evaluations could help identify those who might benefit from targeted therapy. Perhaps one of the most compelling arguments for including testosterone in hormone therapy lies in its role in maintaining skeletal integrity. Osteoporosis is a major public health concern for postmenopausal women, with fractures of the hip, spine, and wrist carrying serious consequences for independence and longevity. While estrogen is well known for its protective effects on bone, testosterone adds another layer of support. By enhancing osteoblast activity and promoting osteoclast apoptosis, testosterone contributes to a healthier bone remodeling cycle. When combined with estrogen, the two hormones work together to preserve bone density more effectively than either alone. This synergy has important implications for fracture prevention and overall musculoskeletal health. It also highlights the need for a more comprehensive approach to hormone therapy that goes beyond estrogen replacement. For too long, discussions about testosterone in women have been shrouded in silence, misinformation, and fear. Many women hesitate to bring up symptoms related to energy, mood, or sexual function, fearing judgment or dismissal. Similarly, some healthcare providers remain reluctant to prescribe testosterone due to regulatory ambiguity and lingering misconceptions. However, the tide is slowly turning. More physicians are recognizing the value of testosterone in alleviating symptoms that persist despite conventional hormone therapy. Patient advocacy groups and online communities are helping to destigmatize the topic, encouraging open conversations and informed decision-making. Transparency and education are key to moving forward. Patients deserve honest, science-backed information about the risks and benefits of testosterone therapy. Clinicians must take the time to explain how it works, what to expect, and how to monitor progress safely. It's also important to address the issue of compounded hormones, which are often marketed as superior alternatives but may lack consistency and oversight. While compounding can be useful in tailoring therapy to individual needs, it should not be seen as a default solution in the absence of approved formulations. As our understanding of female physiology evolves, so too must our approach to hormone therapy. Testosterone is no longer just a footnote in menopause care, it is a central piece of the puzzle. Its benefits extend across multiple systems, offering relief from symptoms that were once accepted as inevitable parts of aging. By integrating testosterone into a broader strategy that includes estrogen optimization, metabolic support, and personalized dosing, clinicians can help women reclaim their vitality, resilience, and joy. This represents a paradigm shift, not just in treatment, but in how we think about aging and wellness in women. The future of women's hormone health lies in embracing complexity, challenging assumptions, and listening to the lived experiences of patients. Testosterone may have been the quiet part of medicine for too long, but now, it's time to speak clearly and confidently about its place in the journey toward holistic well-being. If you found this information valuable, please consider liking, subscribing, and hitting the bell icon so you never miss a future update. Knowledge is power, especially when it comes to your health. Whether you're navigating perimenopause, menopause, or simply seeking a deeper understanding of hormone balance, it's time to start talking openly about testosterone's role in women's well-being. Remember, you don't have to accept fatigue, brain fog, mood changes, or loss of vitality as normal parts of aging. There is help. There is hope. And there is a path back to feeling like yourself again. Thank you for watching.